Well, good afternoon. Today we're going to be doing a microneedling with PRP. So what we've done is we've drawn Joyce's blood, and we are going to spin it down, and we are going to take the plasma, the protein-rich plasma, off of her blood. We're going to draw that off and put it in a syringe. And right now we're numbing her. You can see the white cream on her face, so she is not going to feel anything. Now, what the microneedling is for, it is to provide a controlled damage. And the reason we want to control damage is because at a certain age, usually past about 25, we don't produce collagen anymore unless we're irritated, like from a chemical peel or a scrub, or damaged, like from a laser treatment or a microneedling. So microneedling is actually a lot more controlled than any of those other procedures. It's about 12 little needles that go up and down in the face at a controlled depth. So we make little portals for her plasma to be put back on, and it heals overnight. And it creates collagen, making her skin tighter, getting rid of the fine lines, and even acne scarring. So this is the plasma that we drew off of Joyce, and we put it in a 1 cc syringe. And as Rebecca is going to microneedle, here's the machine, and the tips are changed every patient, and it is protected in a sleeve, so there's no contamination, cross-contamination. And she will do a section of her face at a time. This is Joyce after she's had her cream, the numbing cream, taken off. And she is cleaned her face very well, and she will be dividing her face into sections and doing it a little bit at a time and then applying the PRP. Joyce has a little bit of acne scarring going on at her chin area. And today is her first microneedling, and we're really going to address this. She has a little bit of hypo and hyperpigmentation also that the microneedling will help. And not too many fine lines, but her pores are starting to relax. Go ahead and turn my way, girl. So in her nose, you can see a little bit of her pores. And in her cheeks, they're starting to relax. And that's when we start having our makeup clog in our tissue and our pores. So that's going to cause the pores to tighten up as well. But we're really, really looking for this acne and those fine lines to fill in. It may take several treatments, 3 to 4 treatments, and then we will keep it documented as we go. So here we are. Rebecca has just started her forehead, and you can see the reddening. And actually, the redder it gets, the better results you're going to have. So she spreads a little bit of her PRP on her skin, and then uses that to help glide the microneedling over it. And it is completely numb. She feels the pressure but no pain, none of the puncturing. And because she's using the PRP, Joyce will heal virtually overnight. Now she'll have some sloughing for the next few days, but she will not be red like this tomorrow. She will feel tight, kind of like a sunburn or a windburn, but she should not be red like this at all. And we'll give you, we'll show you the results of the whole face. So she can even go at a different depth on her eyelid there. And if you're losing your brows, this is a great thing to get because it will stimulate the hair growth back for your brow. And a lot of us, have overplucked through the years, and we've lost our brows, and that's why we're doing the tattooing now and the microblading. This will help grow your own brow back. This is the procedure that we also do for hair regrowth. Yeah, so Joyce has a little bit of serum left, and Rebecca's just gonna plump her lips a little bit with a few dollops of serum in her lips. Just like she would fill her. See how that plumped that side up? Isn't that beautiful? Very nice. Very nice. So here is the final treatment. Well, not the final treatment. It's the end of our first treatment. So we've done her complete face. You can see the red. You can see right where we ended. So she should have really good results. And we will have one more step to do, and that is to apply, since her portals that we made in her skin with the microneedling are open to receive. She's going to put the final last bit of her serum on there to go ahead and continue and encourage the healing process.